Welcome. My name is Adam Brazel, an adaptive PE teacher at Fremont County School District number 38 in Arapahoe, Wyoming. This video covers lesson number 10 for the University of Wyoming's Kinesiology 4075. Today, I will cover guidelines for test implementation and interpretation. The first test is the Bruininks-Ostrowski test of motor proficiency, also known as the BOT-2. This test is a norm reference test that assesses the motor functioning of students ages 4 to 21. This test has 53 items divided into 8 subtests. Before administering the test, make sure to familiarize yourself with equipment, scoring, and administration rules. Because this is a standardized test, it is important to adhere strictly to all scoring and administration rules. The administrator can use the color photos in the easel, physical demonstrations, and verbal instructions to communicate the item requirements. Also note that form and speed are important components of some testing items. After recording a raw score, teachers can analyze the data to points for percentile rankings and age equivalence. This can be used to identify strengths and weaknesses, diagnose motor skill difficulties and delays, IEP planning and development, and placement decisions and progress monitoring. The second test is the primitive reflex profile. It's an assessment tool used to quantifiably evaluate the presence and integration of primitive reflexes in a student. Before administering the test, make sure to familiarize yourself with test scoring and guidelines. The scoring scale used is a 5-point system designed to help observe typical and atypical movement responses and to help note the strength of the reflex. To quantify the reflex, use the following scores. 0 equals absent, 1 equals small change in tone, 2 equals physically present and visible, 3 notable strength and force, 4 equals strong. Results of this assessment can be used to develop interventions aimed at targeting and integrating retained primitive reflexes. It can also be used for IEP planning and development, placement decisions, and progress monitoring. The third test is the test of gross motor development 3. It's a norm and criterion reference assessment tool designed to measure gross motor functioning for children ages 3 to 10. This test has a normative component for motor skills that allows a teacher to determine whether a student has delayed fundamental motor patterns compared with other students of the same age. It includes 6 locomotor and 7 ball skill subtests. Each skill is broken down into 3 to 5 components, and the examiner analyzes the skill to see if the component is absent or present. During the assessment, the student is allowed to complete 1 practice and then 2 formal trials. Coding is completed for only the 2 formal trials and should be completed on the examiner record form. This test provides an overall composite score and can be compared to a normative sample. It can then be presented as a percentile ranking or scores comparing the student to others in the same age group. The test is simple to administer and can be used to develop IEP goals, make placement decisions, and record progress monitoring. When completing formal assessments as an APE teacher, it is important to ensure standardization, accuracy, and fairness. This allows the teacher to gather accurate and reliable information about the student's abilities and progress, and then to guide instruction and support for learning. Thank you for listening to my video.